even at a young age, you can develop diabetes because of being overweight or obese. Ang pinaka-problem is yung frequent snacking. You've been doing a lot, hindi ka na kumakain, pero hindi ka pa rin nag-lose ng weight.
I guess in terms of discussion, pwede natin siguro munang simulan yung pag-define ng obesity in relation dun sa ano ba yung kailan nagiging obese, kailan yung overweight, kailan yung tamang weight or yung normal weight.
So obesity, it is defined as depende sa body mass index natin. So body mass index kasi is the simple, reliable way to assess whether a person's weight is actually compatible with their height. So it's defined as the weight over the height in meters, and that's how you come up with your BMI. In terms of World Health Organization or WHO criteria, for normal, it's around 18.5 to 24.9. Above 25 is overweight, and above 30 is obese. But for Asians, like Filipinos, of course, we have the different phenotype as compared to Caucasians, Europeans, so we have actually a lower criteria. Our normal is 18.5 to 22.9. And 23 to 24.9 is overweight, while above 25 is obese.
Okay.
That's for adults.
When you say when we get to compute na yung BMI ng isang tao ay ang resulta ay equals to pagiging obese niya based on sa dun sa sinet na standard ng WHO. Ano naman yung magiging risk factors nito?
You mean parang consequence of obesity, no? So it's very important nowadays that we have to consider that obesity is a disease and it's actually a global epidemic as well. Kasi the incidence is rising through the years with regards to obesity. So that in previous years, no, around 20% lang global population is obese. But right now, it's around 36% already is the prevalence of obesity worldwide. So that's very high. Obesity is related to a lot of chronic diseases. So among them would be metabolic disorders like diabetes, pagtaas ng sugar natin, dyslipidemia, which is very high cholesterol levels, development of hypertension. So not only that, you also have problems with joint pain. Siyempre, pag overweight ka, you have this, sometimes they would complain of low back pain, masakit yung mga joints nila, and also you also develop some breathing problems like apnea, mga sleep apnea, that's also related to obesity. So there's a lot of conditions that can arise from being obese and overweight. And that's one of the things that patients are very nowadays more aware of, so that even during routine physical examination, isa na yan sa naha-highlight din also during work, so that they also get referred to us for their overweight and obesity problems.
Okay. You mentioned that there is a rise. Technically, it has hit epidemic levels na, kumbaga. What do you attribute this rise? Or bakit sa tingin nyo, is it the diet? Is it the lifestyle? Is the COVID pandemic even a factor to that?
If you look back at the history kasi natin, especially with the changes that's happening, if you compare like decades ago during the time of our elders as compared to now, we have revolutionized yung mga restaurants, mga fast food. So a lot of changes has happened. And the industry has also changed. Sabi nila, in the histories, especially with diabetes being epidemic proportions as well, one of the culprit is the rise of yung mga sugary food, like for example, mga sodas. These are one of the things that has been the main culprit with regards to overweight and obesity. You can see a lot of restaurants offering puro soda. And aside from that, you can also see the transition mga children nowadays, physical activities going down. No? Lahat sila nanonood ng TV, video games, laro ng iPad. So definitely sedentary lifestyle, changes in the food intake. These are all part of the problem. And then when the pandemic hit, so everyone was isolated at home, so there's no actually way for them to really go out and do more physical activities. So they tend to also compensate with eating more. So I think that added to the problem as well. So we do have a lot of patients that we've seen after the pandemic who really had gained a lot of weight.
So lifestyle, kasi nga work from home, nakaupo palagi, plus yung gadgets ng mga bata.
Yes.
You mentioned about children, no? How should parents look at it in terms of, parang sa atin kasi culturally, di ba, pag medyo chubby yung bata, parang,
Cute.
uy, cute! Ganyan. So parang, sige, cute yan. Parang, how should we address this in terms of parents? Ano ba yung dapat na pagtingin ng parents regarding this?
Yeah, actually, it's different from children as compared to adults. Like what we said earlier, yung definition natin, obesity is for adults. No? For children, you really have to see your doctors because for children, it's depending on the age and sex-specific growth chart for them. So when they see their doctor, it will be assessed. Obesity for children is more than 95th percentile of their growth chart. So that's different. So depending on the age and sex-specific yon. So definitely it's very important also. Childhood obesity is also on the rise then actually. So if you look at the numbers, even at above 2 years old, 2 to 6 years old, may mga obese na din. So yeah, so actually around mga 12% na yung incidence ng obesity for 2 to 6 years old. And 6 to 19 years old, incidence is around 20%. More often than not, those who are obese in the adolescence or in their younger age would tend to be obese in their adulthood also. Of course, if you're already adults, you develop more comorbidities already. So that very important is prevention. It's the key for obesity also. You start young so that the role of the parents and the school is very important. So maraming studies nagsasabi na if your parents are very active, you would have more active children. But of course, if your parents are also not physically active, so syempre, yung children mo would also tend to follow your lead, di ba? So parehas lang kayo. So you tend to have more overweight children. So it's very important also. And I'm sure our pediatricians, they also try to initiate conversations. The parents themselves, they're more aware also when their children are overweight. So they're also inclined to also try to improve on their diet, so preparation of the food. So medyo mas aware na nowadays ang mga tao with regards to being overweight and obese.
Okay. When should parents start monitoring this? Especially yun nga, nabanggit nyo, pabata ng pabata, 2 to 6. That's quite young, di ba? In terms of parents really, being focused or being more conscious about their kids' weight. Kasi usually, di ba, pakain ka ng pakain kasi gusto mo, healthy and all. So when should they start monitoring it?
Actually, for obesity kasi, for children, prevention is key. So it's actually on a day-to-day basis na talaga yan. So dapat they are overseeing, of course, the nutritional aspect of their children with regards to preparing their meals. So children kasi, ang pinaka-problem is yung frequent snacking, especially if they're eating junk foods. So yun yung mga role ng parents natin. So they have to be, they're the ones buying the food, diba? So they can control yung kinakain ng mga anak nila. And then also the school plays a role, di ba? So most of the schools nowadays, they also don't sell mga junk food, mga soda for younger children. Of course, you see the doctors once in a while. But then, so if you have a good discipline at home, you already incorporate healthy diet, lifestyle at a young age. There's no minimum age for you to start doing that for your children. Problem with being obese or overweight at a young age is that, of course, it affects the whole aspect of their schooling. If you're overweight or obese, you tend to be bullied in school. You develop low self-esteem as well. And you get less confident and it also has an impact on how you do in school. So probably mas mahirapan ka mag-concentrate sa schoolwork mo. Mas konti yung support system with regards to friends. That's one of the main problems also of children who are overweight and obese.
Okay. Doc, you talked about the health risks or yung sa obesity in adults. Does that hold somehow the same as well in terms of obesity with children? I mean, are there also some health risks involved?
So for obesity in children, you'll be surprised that a lot of parents are actually coming to us and to most of the pediatricians also with being overweight and obese. And this should be screened also for other obesity-related conditions. There are already a lot of children who suffer from what you call insulin resistance or having a higher sugar even at a younger age. So we also screen for their sugar conditions kasi that's also one of the consequences. Even at a young age, you can develop diabetes because of being overweight or obese. Yeah.
Okay, so yes, I agree. I mean, that's something that parents should really should watch out for. So if that's the case and we have identified patients, whether children or adults, to be obese, what's the first step in terms of addressing the obesity issue? I mean, the disease, as you mentioned. What's the first step?
So usually, of course, the first step is lifestyle modifications. Basically, we do provide, of course, yung basic nutritional education for our patients, what food to avoid. If really the patient is at a certain level of obesity, we also do calculated diets for them. So we can ask the help of a nutritionist to make a meal plan for the patients para at least talagang makalculate natin kung ilang calorie ba dapat para sa kanila in order for them to lose a certain weight. For patients who are overweight and obese, we have to set a realistic goal for them, of course. For example, 200 pounds ka, you don't expect them to become normal in a few months, di ba? So our goal technically is to lose around 5 to 10% of their weight within 6 months. That's usually the first goal muna for them. How do you do that? You increase slowly their physical activity. You cannot go from 0 to how many minutes a day of exercise. So you start slow, but usually we would want to encourage around 30 minutes a day of moderate form of aerobic exercise 5 times a week, and then slowly go up from there para at least to increase the physical activity. And with regards to diet, it's actually being computed depending on the requirement of individual patients also. But usually we do low-caloric diet, and also we can do calculated specific diet. For example, we can also do meal replacement, wherein you get to your lower calorie faster because of the meal replacement that you can be provided with. So aside from that, there are now treatment options also, medical treatment also for obesity, depending on their level of obesity. Mas mataas yung level ng obesity mo and you already have other conditions like diabetes, hypertension, etc., you can already go for medical treatment. So merong mga oral tablets for overweight and obesity. And of course, you know, yung mga injectable drugs that are very popular in the market nowadays. If you have diabetes and you're overweight, you can already start those injectable medications, or those for obesity alone. There are also injectable medicines for obesity. For those who are really morbidly obese, we also offer like a bariatric surgery wherein you can also go for limiting the digestive system in order for them to feel full and to address obesity for this morbidly obese individuals. So we really have a lot of options already for them. But it starts, of course, with their diet and lifestyle change talaga.
In terms of food, usually when we talk about food and the idea of relating it to diet, di ba? Parang ang automatic na iisip ng mga tao yung mga kung ano-ano ng diet din. Yung mga South Beach ba yan? Yung mga, yung mga ano. Is that safe for them to try? Or how should people approach that?
Through the years, there are a lot of diet fads that came up. No? So it's very difficult to choose one. But basically, what we want is a calculated diet. So when you say a calculated diet, it's actually a balanced meal. It's just that you have to compute for the caloric dapat low-caloric meal. So, ibig sabihin, initial requirement is, for example, 2,000 calorie and you want to lose weight. So, we usually subtract like 500 calories for you per day and then we compute. So, you have to like be on a limited calorie. For example, 1.2 to 1.5 a day lang lagi. So, you have to stick to that low-calorie diet and then you would expect a certain weight loss after sticking to that diet. So it can be a balanced meal. So hindi porket taga-diet ka, hindi ka na pwede mag-rice, etc. But then, pwede pa rin. But then you have to stick to a certain total caloric requirement.
So you're saying it's more important to be conscious about the calorie intake, the counting as compared to like just following a particular
particular diet. Because what we want is a lifestyle change. You don't want to go for a fad diet that you can only sustain like for a month or 2 because the rebound is really there, no? So hindi naman yan magiging long-term weight loss for you. So you won't be able to achieve the weight loss that you desire and maintain it and sustain it really for you to adopt a certain diet. So you want to go for a diet that you can sustain.
You mentioned naman about the medications for losing weight. Siguro minsan yung ibang tao pag narinig yan talagang susugod sa butika to get the So, ano yung siguro magiging reminder natin sa kanila tungkol dyan about getting the drugs and the medication that...
So for medications in general, kasi we do have a lot of options nowadays as compared to before. But for medications, we have to emphasize that you have to see your doctor for that. Because individually, you have different conditions. You can't follow what your friends are taking, di ba? So usually, ganun naman pag for most patients, no? So, pumayat siya sa ganitong gamot. Maybe I can also take that. But they also have other conditions. Baka iba yung condition niya. That's why she was given that particular medicine. So, it's very important for medications that it has to be supervised. Even for those injectable medicines that are in the market nowadays, you have to be supervised when you're taking those medicines.
So, we don't just buy them? We don't just administer it to ourselves?
Yes.
Kailangan merong advice ng doctor?
Yes, may supervision kasi may minomonitor din tayo para doon.
Yung isa namang nabanggit nyo, Doc, is yung surgery. So, when does it become an option for people with obesity?
For bariatric surgery, because of course it is a major decision for the patient, no? Usually, those who are with a BMI of above 35 with comorbid conditions, these are those that fit the criteria already for going for not only medical management but possibly a surgical intervention already. Because this can already affect the quality of their life with that level of obesity, as well as can also increase their morbidity and mortality as well. So, ganung klaseng level ng obesity, you have to already offer the option of bariatric surgery. And there are a lot of different surgeries that can be offered for the patients. No? Merong mga mas minimally invasive, merong mas aggressive kind of surgeries that has to be discussed with their own physicians also. And of course, we also refer to, it's a team. Team kasi ang nagte-take care of a patient who's going for a bariatric surgery. You have your nutritionist, you have your surgeon, you have your endocrinologist like us. You also have your psychiatrist. So there's a whole team that can help you when you want to go for this kind of surgeries.
Siyempre, yung mga tao pag nakita sa ads, oy, food supplement na nakaka-lose weight, or yung mga tea, slimming, are those safe? Is that something that doctors would recommend?
Normally, if it's a supplement, it means that there's no therapeutic claim. So we cannot really offer that to our patients. We cannot back it up with evidence. So whenever you come see the doctor and you ask for prescription, we always prescribe medicines that already is evidence-based. We cannot give supplements because of course, hindi nga siya backed up by evidence. So, but there are a lot of people who are consuming that. So, you have to be aware of the limitations of the supplements, and nakalagay naman, naka-warning naman dun, but then still very popular in the market. So, really have to be aware and educated of all those supplements that are really promising unrealistic mga goals for you for weight loss. Yeah.
So, ang tamang approach ba dito, Doc, is that, yun nga, nabanggit nyo, there is no one solution for obesity, and it's reliant on a particular patient's condition?
For obesity, the approach is, of course, when you yourself has decided to lose weight, or you have to seek professional help also, because that the doctors can guide you with regards to your condition. Kasi when you are overweight or obese, we do a lot of tests first to know if you have certain conditions that has resulted to you being overweight or obese. Baka you have hormonal imbalances or other comorbid conditions, because this can actually have an impact on how we manage also your weight. So sometimes it's difficult for you to lose weight just by doing diet and exercise alone. Yung pala, meron kang problems with your hormones. So this has to be addressed. If you don't see the doctor, you don't see your physician, then magiging frustrated ka with weight loss because kala mo, you've been doing a lot, di ka na kumakain, pero di ka pa rin nag-lose ng weight, diba? So really very important also to check with your physician or your doctor for that, para at least they can guide you. Kasi not only behavioral treatment is important, but also screening for other conditions that has association with being overweight and obese.